It's Wednesday. Welcome to our Wednesday Wellness Tip. For today's physical tip, I'd like to talk about the herb Neem. N-E-E-M. Now, if you grew up in India, you would know all about Neem because the neem trees grow everywhere. We're just starting to appreciate the many medicinal uses of neem. It's great as an antioxidant. And remember that oxidation in our bodies is like molecular rust. So anytime we have an antioxidant, such as vitamin C, that's a good thing to get rid of the damaged cells. It's also a good anti-inflammatory, which means it can reduce the inflammation. And we've seen quite a few patients, especially after COVID, to have an inflammatory state. So we're very curious to see if this will help reduce that inflammatory states. The other thing is good against cancer. It causes apoptosis, which means that it can kill an abnormal cell or a cancer cell. So recently, one of my colleagues shared with me where she used the neem along with turmeric and an anti-inflammatory diet in a patient who had prostate cancer. His PSA was in the 80s, and after 2 months of following an anti-inflammatory diet, using turmeric and using neem, his PSA has returned to normal. So this is very promising. Now you have to use caution because there are side effects. It should not be used in anyone who is pregnant or who is nursing. And we definitely recommend that it's used under the guidance of a practitioner because long-term use may not be beneficial and it can cause nausea or diarrhea. So we recommend it for a short-term use, 1 to 2 months, under a practitioner's guidance. And we do think there's very promising results from neem. We found a good source of neem capsules that we will now be carrying in our office. So that's our physical tip for today.